Hi, my name is Brooke Taylor. I am a current registered nurse studying at Eastern Kentucky University to achieve my master's and become a psychiatric mental health nurse practitioner. I am choosing to present today on physical activity as a supportive therapy for those recovering from substance use disorder. I am looking at specifically the adult population, which will be seen frequently in most settings by the psychiatric mental health nurse practitioner, or PMHNP. Healthy People 2030 goals have been previously unmet related to substance use disorder, indicating that it is a growing problem. One such goal that has been unmet is the goal of reducing drug overdose deaths, and sadly those are increasing in the United States, indicating the need for further treatment options for patients suffering from substance use disorder. Physical activity has been speculated to be effective in improving patient outcomes, and it's been used in a variety of studies to help patients with existing treatments add further therapies to their repertoire to be able to help themselves in further recovery. One study called The Effects of Group-Based Aerobic Exercise Program on the Cognitive Functions and Emotions of Substance Use Disorder Patients, a randomized controlled trial, was published in the International Journal of Mental Health and Addiction. In this study, it was shown that exercise was used to further investigate the effects of group-based aerobic exercise in promoting cognitive functions and emotional states of the substance use disorder patients. The study demonstrated a level 2 randomized controlled trial that demonstrated effective use of exercise for promoting increases in symptoms such as emotional state, cravings, and physical fitness. The next article I examined was a level 1 article, Exercise in the Treatment of Addiction, a Systematic Literature Review. The purpose of that study was to add to previous work exploring the relationship between exercise and addiction-related outcomes. This study reviewed 53 previous pieces of research and showed improvements across the board in cravings. 27 of those studies reported improvements in use or abstinence for their patients, and 10 reported improvement in results of withdrawal symptoms. 21 of the 53 studies examined showed improvement in mental health related. The theoretical background for this problem and seeking to improve it that I was able to find was within Barker's tidal model of mental health recovery, which seeks to reconceptualize the person as a patient, which is essential in addictions treatment because we are fighting provider bias and environmental biases where these people are not treated well on a daily basis. The addition of physical activity may be one intervention that can help the person feel better, to improve all aspects of their health and have better overall treatment outcomes. With an interdisciplinary team of at least 10 researchers, I sought to improve knowledge about physical activity for substance use disorder and wanted to do some research in my current work area of Towson, Maryland. I would like to collaborate with kinesiologists to establish a daily exercise calendar plan for a group of patients who were inpatient from the beginning of treatment for substance use disorder, with the continuing exercise plan to follow them after discharge. Outcomes will be measured in a 3-month period. We will discuss with patients who may or may not have completed the program what their results were in improvement of cravings and other withdrawal symptoms, as well as overall mental health and physical fitness. We can even look at benefits in BMI for those patients, as that may improve over time with physical exercise. To conduct the research, I would like to assess vital signs, EKGs, BMI, and conduct stress testing for patients who voluntarily choose to participate in the study. I would like to publish a high-quality final product for publication in appropriate medical journals to share with other providers and disperse to their patients, providing educational graphics, and I would also like to include the plan that we used in our study design developed by a kinesiologist for other patients to use in the 3-month period following their either diagnosis or medical intervention with the provider for substance use disorder. In month 1, I would gather at least 10 willing professionals to participate in the facilitation of the study from different specialties related to substance use disorder. I would like nurses, psychiatrists, recovery counselors, emergency medicine providers that may see the patients in the emergency room more frequently, social workers, and other relevant staff to create a diverse interdisciplinary team. I would then seek to find participants in inpatient substance use treatment disorders, which I have several examples available in Towson, Maryland. I would not publish which facilities were used to help protect the patient's identities and confidentiality. I would gather participants from introductory sessions where we could teach them about exercises and supportive therapy, and then enroll willing participants from those series of educational infographics and educational meetings. I would collect demographic data. Participants who are over the age of 18 would be eligible because I do want to study specifically adults. We would conduct health screenings and receive approval from a primary care doctor for each of these patients that they were safe to participate in moderate exercise. We would then have patients rate their withdrawal symptoms, cravings, and energy levels, and mental health on a scale from 0 to 5. For the months 2 through 4 that will follow, we would include thoroughly screen participants in a guided group exercise for half an hour on weekdays, with exercises to follow them after discharge. We would follow 3 months whether they were inpatient or outpatient, and include outpatient groups and stream our sessions virtually via Zoom so patients can be encouraged to continue participating in the program. And at month 5, we would then review our results, ask participants who completed the 3 months of exercise to again rate their symptoms from prior to screening on the same factors, 0 to 5, and evaluate our data and modify the exercise program as necessary. We wouldn't know initially if this program was effective until we had received enough participants. So we would want statistically significant data, and an appropriate goal would be at least 20 participants. The more the better, but there are other outlying variables that may impact this. And I would like to seek further advice from other providers in the area and see what their biggest concerns are related to substance use disorder. Okay, thank you.